somehow I decided not to go through a reconstruction. Plastic surgeons, they usually really like to reconstruct breasts. So every time I would meet with one, and I think I met with at least 4 of them, they give me the whole spiel of all the options of reconstructing your breasts. And it's a long spiel. It doesn't leave a lot of time to ask about what about my flat closure options, because plastic surgeons, they don't really like the flat closure because there's nothing to do there, right? Most of them are used to doing breast reconstructions with implants, with fat grafting. And then when I come to these plastic surgeons asking about the option to just do a flat closure, they're really not excited about this option. So they only just like brush it off as an option, but I was feeling like this isn't a good match. So I was looking into a surgery that's called Goldilocks. It's an option that's kind of in the middle. And with Goldilocks, you're not really reconstructing with implants or fat grafting, but with the skin and fat tissue that's left after you remove all the breast tissue, and you kind of reconstruct that to make a little mound and a smaller size breast. So I heard about this option, and it's kind of an old new concept, and not a lot of plastic surgeons are happy to do that or have any experience to do that. And it's hard to find surgeons that would. I went and found the one New York plastic surgeon that was written in the directory as someone who would do the Goldilocks procedure. I went to see her in New York, and she saw me, and she wasn't so excited about doing the Goldilocks in my situation. I guess I don't have big enough breasts for that, and I got the whole spiel about normal options for a reconstructing surgery. I was kind of disappointed that I'm not the best candidate for Goldilocks. So the next thought that came to my mind is, what about transgender top surgeries? How do they do that as an aesthetic closure to look like men's breasts? And I went and talked to a few people that did this surgery for gender purposes, and I found out that different kind of plastic surgeon do this surgery with a focus on the aesthetic of turning a female breast into male breast. So I'm going to continue in the next part.